So many pregnant women have been told by their doctors to watch their salt intake. And the first thing that comes to mind is usually hypertension, but there is a lot more to salt than that. Let's take a deeper look at this very versatile ingredient. Hello and welcome back to Nurse Onyi Teaches. My name is Onyi. If this is your first time here, you are most welcome. And if you are a returning viewer, thank you for coming back. If you haven't done so already, make sure you hit the subscribe button and then don't forget to turn on your notification bell because that's how you are made aware of every time a new video is uploaded. As you can tell from the title of this video, we are going to be talking about salt. There are many different types of salt, and salt can be found in a lot of different products. But today's video is going to focus on table salt and how it affects a pregnant woman's body. Now, table salt contains two very important elements, and that is sodium and chloride. We are going to be focusing on sodium and how it affects a woman's body. Now, sodium is very important for a lot of functions in the human's body. It helps to regulate fluid balance so your body does not carry around too much fluid or too little fluids. It's also very important in how your muscles function, and your nervous system heavily depends on sodium for proper functioning. Your healthcare provider knows why they tell you to watch your salt intake during pregnancy. Too little sodium can also be a problem as much as too much sodium can be a problem. Some of the effects of insufficient sodium intake include nausea and vomiting, headache, you can be drowsy, you can feel fatigued very easily. And you remember how I said that your nervous system depends on adequate sodium? Without enough sodium in your body, you can deal with muscle weakness and you can have cramps. Now, when I was pregnant with all my children, I dealt with a lot of sciatic nerve pain. Because of the way the body moves and shifts around when a woman is pregnant, there is already an increased use of muscle and nervous system activity. If you don't have enough sodium in your body, you can increase the irritation of those nerves, causing your body to more likely deal with things that are unprofitable. So make sure you are getting the right amount of sodium, and I will talk about that later on in this video. Now, if you get too much sodium in your diet, yes, hypertension is one of the most negative outcomes from it, but a pregnant woman can also experience things like increased urination because your body has to flush out that excess sodium somehow, and then your body will also cause you to be thirsty more frequently. So if you are taking in more salt than you should take, you're going to have more trips to the bathroom. You're also going to deal with headaches. Now, I've mentioned headaches for too little, and I've also mentioned headaches for too much. So if you don't want to deal with headaches, it's very important to stay at a very balanced intake of sodium. Another symptom of excess salt intake is bloating and swelling, especially in the extremities. Women who take in too much salt while they are pregnant can have the skin around their feet swell so badly. And then when your skin is busy stretching to accommodate all this extra fluids, it can stretch and break, and you have a higher incidence of stretch marks forming in your body. Now, the fluids can resolve, but the stretch marks tend to be a lot more permanent. They can fade and be a lot less visible, but they will always be there. Now, the amount of sodium that a mom takes in can also affect her developing baby. During those first critical weeks of development after a pregnancy just begins, it is so important that a mom gets the right amount of sodium so that her baby's placenta can be formed well. In the case of an underdeveloped placenta, nutrients and waste cannot be effectively exchanged between mother and child. That can lead to very negative outcomes such as a low birth weight in your fetus, or it can also cause issues like a baby who has muscle or nervous system issues. So to avoid these things, once more, moms should make sure they are taking in enough salt in their diet. Now, if a mom takes in too much salt in her diet, that can also prove very dangerous for babies. There is so many research out there proving that your baby's kidney function can be affected by how much sodium a mom takes in. Namely, if your sodium intake is too high, then your baby's kidney function becomes lower and not as effective. You definitely want your baby to be able to control how much urine he or she puts out, how well his or her kidneys function to exchange waste out of their body. And if this issue is not properly controlled during pregnancy and resolved, then your child after being born can have long-lasting effects as he or she begins to grow. So it's very important to take in not too much and very important to take in not too little. So experts recommend that women get at least 1 gram of sodium per day, but no more than 6 grams of sodium per day. 6 grams of sodium translates roughly out to about 1 teaspoon. Now, keep in mind that 1 teaspoon of sodium means the amount of sodium that you take in the entire day. And that includes the bags of chips, the cereals, the canned foods like the beans, or even some of the flavorings used to enhance the taste of food contain sodium. It's also important to keep in mind that if you are going to like a restaurant or something, you're not able to readily measure how much sodium that they put in the food. And it's best for you to just kind of make your own food at home. You also want to be careful about cheese because cheese is aged and is preserved and contains a lot of salt. Other foods like pickles, pizza, bacon, some of the things that people enjoy without thinking about how much sodium is in it can contribute and greatly increase the quantity of sodium that a woman is taking in on a daily basis. So I certainly hope that women are a bit more aware that it's more than just hypertension. There's so much more involved where sodium is in the human body. And I hope that this video proves very helpful to you. Now, if you have learned something from it, be sure to give it a thumbs up and then subscribe if you haven't done so already. If you know somebody who can benefit from the content of this video, do not fail to share it with them. I wish every pregnant woman out there a safe and healthy pregnancy. I want you to be as happy as possible. And until the next video, make sure you stay tuned and be blessed.